Yeah.
That moment, you know it. The one where you start thinking about expanding your family or maybe even starting one for the very first time.
Yeah.
It's this huge, exciting, and, let's be honest, often a little bit daunting step. Immediately, your mind floods with questions. Am I truly ready for this? What should I be doing right now? What if something goes wrong?
So many questions.
Exactly. Our deep dive today is all about answering those vital questions before you even try to conceive, giving you the best possible head start on this incredible journey. We're framing this deep dive as preparing for pregnancy, your ultimate health roadmap, because it's so much more than just figuring out how to get pregnant. It's about proactively optimizing your health and your life for the healthiest possible beginning for you and your future baby.
That's key.
We are really zeroing in on comprehensive preconception care, a topic that honestly is far too often overlooked in the excitement and anticipation of planning a family.
And to guide us through this absolutely crucial topic, this deep dive pulls critical insights from a range of meticulously reviewed sources, primarily from BabyCenter.
Okay.
These aren't just opinions you'll find in a forum, They're evidence-based guidelines featuring the collective expertise of various medical professionals. We're talking about seasoned OBGYNs, maternal fetal medicine specialists, expert dietitians, and insightful genetic counselors.
Wow, quite the panel.
Exactly. Their combined wisdom is designed to truly empower you, the listener, with actionable, reliable knowledge.
Our mission today is to sift through this wealth of information and distill the most important, actionable nuggets. Think of it as your shortcut, maybe, to understanding everything you need to know about proactive health planning before conception.
Right.
We're aiming for those genuine aha moments that will cut through any information overload and give you a clear step-by-step roadmap for a healthier pregnancy journey. As we delved into these sources, one thing that really stood out was just how profoundly preparing your body and your life before conception can impact everything. What's the core insight here about why this early preparation is so crucial?
It's truly fascinating, isn't it? How much proactive health impacts not just the act of conceiving, but the entire trajectory of the pregnancy and even the baby's long-term health.
It's more than just getting pregnant.
Way more. Think of it as truly preventive medicine at its best, giving your future child the strongest possible start from day one. The big question that emerges is, what exactly does preconception care involve? And why is laying this foundation so fundamental?
Right.
It's about building the best possible environment from the ground up, really.
And speaking of laying that foundation, the sources repeatedly stress this preconception checkup as the absolute first item on the checklist.
Foundation.
For many of us, the instinct is to call an OBGYN after we're pregnant, almost as a reaction to a positive test. But why is it so incredibly important to have this conversation with your doctor before you even start trying? It feels like such a shift in thinking for a lot of people.
That's a crucial point, and it's all about timing. When we look at the bigger picture, many of the most crucial developmental stages for an embryo happen in those very early weeks of pregnancy, often before a woman even realizes she's conceived.
Weeks 0 to 4, basically.
Exactly. Getting your health squared away beforehand optimizes that early internal environment. For instance, imagine discovering a vital nutrient deficiency during pregnancy that might limit your treatment options or add significant stress.
Yeah, that sounds stressful.
But by addressing it proactively before conception, you can literally alter the outcome for the developing embryo, potentially preventing complications and setting the stage for a smoother, healthier 9 months. It's about taking control of the variables you actually can control.
So it's not just a quick chat then, is it? Our sources describe this preconception checkup as a comprehensive health inventory. What can someone truly expect when they walk into that appointment? What kind of information are doctors looking for, and why?
It's absolutely a deep dive into your entire health history. Your practitioner will start by taking an extensive history and providing counseling.
Okay.
This includes a thorough review of your current and past medical conditions. We're talking about things like asthma, diabetes, high blood pressure, any blood clotting disorders, or thyroid disease.
The big stuff.
Right. They'll also ask about past surgeries, hospitalizations, and even any reactions you've had to anesthesia. The sources emphasize the importance of complete honesty here because every piece of information helps the doctor identify potential issues and create a truly tailored plan for you.
Makes sense.
Family medical history is also vital for identifying any genetic predispositions or conditions that might affect the baby, so be prepared to discuss that as well. It's like gathering all the pieces of your unique health puzzle.
That makes perfect sense, building that full picture. And what about your reproductive history specifically?
On the gynecological and obstetric side, your practitioner will definitely need a detailed menstrual history. If you're not already, it's a good idea to start keeping a menstrual calendar right now.
Good tip.
This helps pinpoint ovulation more accurately and estimate due dates later on. They'll also discuss your current birth control use. For example, methods like the Depo-Provera shot. Well, that can significantly delay the return of fertility.
How long are we talking?
Sometimes up to a year or even more after the last shot. So, if you're hoping to conceive soon, this conversation is critical for discussing switching methods. They'll also inquire about your history with STI sexually transmitted infections and pap smears.
Right.
It's important because many STIs can be silent, meaning they don't cause symptoms, but they can lead to problems with fertility, like pelvic inflammatory disease or complications during pregnancy.
So screening is key.
Screening is crucial, especially if you're not in a monogamous relationship or have a history of multiple partners. If you've been pregnant before, they'll ask about those experiences, including ectopic pregnancies, which can reduce fertility and necessitate early ultrasounds in subsequent pregnancies.
Okay.
They'll also delve into a history of recurrent miscarriage, which might prompt chromosomal testing or checks for underlying health problems. Questions will cover complications during delivery, any postpartum issues, including mental health concerns like postpartum depression.
Which is so important to talk about.
Absolutely. And any problems with previous babies. For instance, if you've had a baby with a neural tube defect like spina bifida, your doctor might recommend a higher daily dose of folic acid before and during your next pregnancy. It's about learning from your body's unique journey.
Wow, that is incredibly thorough. It really sounds like they're trying to build a complete picture of your body's past experiences and future potential.
Yeah.
What about medications and vaccinations? That feels like something that could easily slip your mind when you're caught up in the excitement of planning a family.
You're absolutely right. It's a key area. You'll need to bring a complete list of everything you take, and I mean everything. Prescription drugs, over-the-counter medicines, vitamins, herbs, and any other supplements, including their dosages and how often you take them.
The whole medicine cabinet, basically.
Pretty much. This is critical for ensuring nothing is unsafe during pregnancy or requires dosage adjustments. For instance, our sources warn against taking excessively high doses or mega doses of certain vitamins like vitamin A, which can actually be harmful to a developing baby.
Right. More isn't always better.
Exactly. This is why always following your doctor's specific dosage recommendations is crucial, and never stopping prescribed medications without explicit guidance from your healthcare provider. Your doctor needs to manage those changes carefully. Vaccination history is also incredibly important. Contracting certain diseases during pregnancy can lead to serious birth defects or complications for the baby.
Like rubella.
Exactly. Your immunity to diseases like rubella or German measles and chickenpox will be tested. If you're not immune, vaccination will be recommended, and you'll typically need to wait about 1 month after the shot before trying to conceive.
Okay, a waiting period.
Yes. The Tdap vaccine, which covers tetanus, pertussis, or whooping cough and diphtheria, is also recommended, along with the current flu vaccine if it's flu season. If you're 26 or younger and unvaccinated, the HPV shot might be advised, and hepatitis B if you're at risk.
So, updating everything.
Pretty much. And if you have international travel plans, you'll need to inform your doctor, as additional region-specific vaccines may be required, and some are unsafe during pregnancy. It's all about creating the safest possible environment.
That's a lot to consider before you even start trying. It really drives home that preventive medicine aspect. What about the more personal, less clinical aspects, like emotional well-being or even social history? Do doctors delve into that?
Yes, they absolutely do, and it's a crucial part of the holistic picture. Your practitioner will inquire about your emotional and social history, including any past mental health problems like depression or eating disorders. They'll want to know this because medications for these conditions might need adjustment, and trying to conceive and pregnancy itself can bring significant emotional ups and downs. Transparency here allows for better support tailored to your needs.
Makes sense.
A truly critical and often difficult topic they'll address is domestic violence. It is paramount to be honest if you are or have been a victim of domestic violence, as abuse often escalates during pregnancy.
That's heartbreaking, but so important to address.
It is. Providers can offer vital confidential resources like counseling, legal services, hotlines, and safe havens. It's about ensuring your overall safety and well-being.
That's incredibly important. Beyond the medical history, what about daily life, your diet, your exercise routine, things like that?
Yeah. Your lifestyle questions will also be thoroughly reviewed. Your practitioner will look at your current diet and recommend an exercise program. If you're overweight or underweight, a plan to reach a healthy weight will be discussed.
Ah, the weight discussion.
Yes. They'll advise you on specific foods to avoid, like certain fish high in mercury or unpasteurized products, raw or undercooked meats and eggs, to prevent infections like listeriosis and toxoplasmosis.
Listeria, yeah.
Limiting caffeine and completely avoiding alcohol and recreational drugs are also strong recommendations. They'll also discuss potential environmental hazards at home or work, such as lead in old pipes, pesticides, or even cat litter due to the risk of toxoplasmosis.
Cat litter, really.
Yes, the toxoplasmosis risk is real if you're handling soiled litter. And a key warning often reiterated is against hot tubs and saunas. Elevating your body temperature too high, especially early in pregnancy, can interfere with your baby's development and even hinder conception itself.
No hot tubs then.
Best to avoid them. Finally, your oral hygiene is also part of this conversation. Dental checkups and cleanings are stressed because hormonal shifts during pregnancy can increase susceptibility to gum disease, which some studies link to preterm delivery.
Wow, even dental health.
Exactly. So as you can see, it's not just about your uterus, it's about your entire system, head to toe.
So after gathering all this history and discussing lifestyle, what about the physical exam itself and any tests? What does that typically involve during a preconception checkup?
After the history and counseling, you'll likely have a standard physical and gynecological exam. This includes measuring your height, weight, and blood pressure.
The basics.
The basics. The doctor will examine your genital area for any suspicious lesions or infections, taking swabs as needed. A pap smear will be done if it's due, along with screening for common infections like gonorrhea and chlamydia. A pelvic exam will check your ovaries, uterus, and cervix for any masses or tenderness. For lab tests, your practitioner may request a urine sample. If sugar is detected in your urine, you might have a glucose tolerance test to check for diabetes, as uncontrolled blood sugar can have severe consequences for a developing baby.
Right, checking for diabetes early.
Yes. Symptoms of a urinary tract infection would also lead to a lab culture. Blood tests are also common. These can include a complete blood count to check for iron deficiency anemia, immunity checks for rubella and chickenpox, and screening for conditions like syphilis, HIV, herpes, especially if your partner has a history, and hepatitis B if you're at risk.
A whole panel of blood work.
Typically, yes. They might also consider screening for cytomegalovirus or CMV antibodies, which is particularly important if you are around children in daycare, as CMV can easily spread in those environments and be passed to you.
CMV, okay.
It's all part of painting that comprehensive picture and understanding your unique health blueprint.
That makes so much more sense when you frame it as building a health blueprint. It's clear that this isn't just a list of things to tick off, but a truly strategic approach to health. It's about being proactive, not reactive, and preventing potential issues before they even begin. Now, let's unpack this further. It's not just about what you avoid, but what you do proactively. Our sources really underscore the importance of achieving and maintaining a healthy weight. Why is this such a crucial factor in the preconception period, beyond just general well-being?
What's truly fascinating here is how the body's metabolic and hormonal systems are so deeply intertwined, especially when it comes to fertility and pregnancy.
It's all connected.
Exactly. When we connect this to the bigger picture, achieving a healthy weight preconception creates a far more stable internal environment. This directly influences things like ovulation regularity, making conception more likely, and also significantly reduces strain on the body during pregnancy. It's really about building metabolic resilience.
Metabolic resilience, I like that.
Being at or close to your ideal weight is profoundly impactful on both your chances of conception and the overall health of the pregnancy. Our sources explain that being overweight can cause irregular menstrual cycles, which directly contributes to infertility.
Okay, direct link there.
And overweight women also face increased pregnancy complications like hypertension, gestational diabetes, and potentially more difficult deliveries. On the flip side, a low body mass index, or BMI, can increase the risk of low birth weight and preterm birth for the baby.
So extremes aren't good either way.
Right. So the actionable advice is to focus on sensible eating and regular exercise, rather than fad diets, aiming for a gradual, sustainable weight loss of 1 to 2 pounds per week to ensure you're losing fat, not just fluid or muscle. This stable metabolism translates to a much more stable, nurturing environment for a developing fetus.
So it's about optimizing the internal environment for conception and for the entire 9 months. And that leads us right into nutrition, which feels like the other side of that coin. What does this deep dive tell us about nourishing your body and the vital role of supplements?
Proactive nutritional preparation is absolutely vital. It's almost like fueling up for a marathon, isn't it?
Huh. Yeah, it kind of is.
Our sources strongly advise starting prenatal vitamins right now. They emphasize the critical role of folic acid, 400 micrograms per day, taken at least 1 month before conception and throughout the first trimester.
Folic acid, always hear about that one.
And for good reason. This isn't just a general recommendation. It significantly reduces the risk of neural tube defects like spina bifida and anencephaly. The reason starting early is paramount is because the neural tube, which develops into the brain and spinal cord, closes by day 28 after conception.
Wow, that's early.
Very early, often before pregnancy is even detected, so you need those reserves built up. Beyond folic acid, iron, calcium, and omega-3 fatty acids are also highlighted as important for overall maternal and fetal health. For a balanced diet, the guidelines are quite specific for daily intake. At least 2 cups of fruit and 2.5 cups of varied vegetables daily.
Lots of fruits and veggies.
Definitely.
Yeah.
Including dark green, starchy, and orange types, as well as vitamin C-rich fruits and dried beans or legumes. Plenty of whole grains, calcium-rich foods like milk, fortified orange juice, and yogurt, and diverse lean protein sources such as fish, beans, poultry, meat, pork, eggs, and nuts are recommended.
A real variety.
Yes. Incorporating healthy fats like canola or olive oil about 6 teaspoons daily, and actively avoiding trans fats is also advised. It's about a wide spectrum of nutrients, not just one magic pill.
Fish is often tricky during pregnancy because of mercury concerns. What are the specific recommendations regarding fish intake?
You're right, it's a common point of confusion, but the guidelines are quite clear. While fish is an excellent source of omega-3s, which are very important for a baby's brain and eye development, as well as protein and vitamin D.
The good stuff.
Right. But you do need to be careful about mercury levels. The FDA recommendations detailed in our sources advise avoiding high mercury fish entirely. These include shark, swordfish, king mackerel, marlin, orange roughy, big A tuna, and tilefish.
Okay, good list to know.
For solid white canned tuna, it's recommended to limit it to no more than 1 6-ounce serving per week. Instead, focus on consuming 8 to 12 ounces weekly of low-mercury seafood, like salmon, cod, or light canned tuna. As for caffeine and alcohol, the advice is clear and unequivocal. Limit coffee or tea consumption due to their potential impact on baby's health.
How much limit?
The sources often suggest keeping it under 200 milligrams a day, but it's best to discuss specifics with your doctor. And once you start trying to conceive, complete alcohol abstinence is strongly recommended. Alcohol crosses the placenta and can cause lifelong cognitive and behavioral problems in the child, so it's a non-negotiable step for optimal health and development.
Zero alcohol. Got it. That brings us to other lifestyle habits, beyond diet and exercise. Our sources talk about eliminating detrimental habits. This feels like a big one for many people, given how ingrained some habits can be. What's the impact of things like smoking or drug use, and how can someone approach breaking those habits before pregnancy?
Eliminating detrimental lifestyle habits is, without question, a non-negotiable step for optimizing fertility and ensuring a healthy pregnancy. Smoking and drug use carry severe risks,
Like what specifically?
including an increased likelihood of miscarriage, premature birth, low birth weight babies, and even sudden infant death syndrome, or SIDs. Tobacco use specifically impacts fertility, lowering sperm count in men and reducing a woman's ability to get pregnant, and even secondhand smoke exposure can have a negative effect.
Even secondhand. Wow.
Yes. Our sources highlight that nicotine acts as a vasoconstrictor, meaning it dangerously narrows blood vessels, directly impacting crucial blood flow to the placenta, which is vital for the baby's growth. For smoking cessation, our sources provide a very practical, gradual tapering off plan, such as the one suggested by Dr. Meredith Goodwin.
Okay, how does that work?
In week 1, you simply record your daily cigarette count without trying to cut back, perhaps by posting a calendar on your fridge. This creates awareness without immediate pressure.
Just observe first.
Right. In week 2, you identify your highest daily count from week 1. Let's say it was 25 cigarettes. For each day of this week, you pre-count that number and stick to it, not carrying leftovers to the next day. The focus is on consistency at that level.
Okay, setting a baseline.
Exactly. Then, from week 3 onwards, you reduce that daily allowance by 1 cigarette each week. This slow taper is designed to minimize painful withdrawal symptoms. The goal is to be nicotine-free for at least a month before trying to get pregnant.
Slow and steady.
That's the idea. The sources also strongly reiterate the importance of seeking professional smoking cessation support because you absolutely don't have to do it alone. There's help available.
That's a very practical, step-by-step approach to what can be a really challenging habit to break. Beyond quitting smoking, what other habits are important to consider, especially environmental ones?
Establishing a regular exercise routine is also key. The American College of Obstetricians and Gynecologists, ACOG, recommends 150 minutes of moderate physical activity weekly, plus muscle strengthening activities on 2 or more days.
That's the standard guideline, right?
It is. The advice is to encourage activities you actually enjoy: hiking, cycling, swimming, dancing, or weight training, and to ease into a routine if you're currently inactive, perhaps starting with 10-20-minute walks daily. Exercise not only aids physical health, but also profoundly helps with stress management, which is important for overall well-being. When it comes to environmental hazards, it's about identifying and reducing exposure to potential dangers in your home or workplace.
Like lead pipes?
Yes, things like lead, which can be found in old pipes in drinking water, mercury, beyond just fish, potentially in other forms, certain pesticides and fertilizers, and, as we mentioned, cat litter containing feces due to the toxoplasmosis risk.
Right.
It's important to discuss any occupational exposures, like routine exposure to chemicals or radiation, with a healthcare provider. And again, the warning against hot tubs and saunas is reiterated. Elevating body temperature too high, especially early in pregnancy, can interfere with fetal development and can also make it harder to get pregnant.
So stay cool.
Essentially, yes. Think of it this way. Creating the cleanest, healthiest internal environment truly supports the quality of your eggs and sperm, setting the earliest stages of your baby's development up for the best possible success. These factors, often overlooked as minor habits, profoundly affect cellular health and reproductive function.
So we've talked about preparing your body, but what about understanding potential roadblocks and solutions on this journey? Carrier screening sounds incredibly important, but it also feels like a lot to wrap your head around with all those different conditions and probabilities.
Yeah.
What's the key takeaway for someone trying to navigate this?
When we connect this to the bigger picture, it's truly about empowerment through knowledge.
Knowledge is power.
Exactly. Proactive genetic carrier screening can reveal risks for inherited disorders before conception, enabling couples to make truly informed decisions and prepare, rather than being surprised later. So what exactly is genetic carrier screening? It's testing performed on prospective parents to determine if they carry a genetic mutation that could cause a serious inherited disorder in their baby.
Like cystic fibrosis.
Yes, our sources mention common disorders screened for: cystic fibrosis, sickle cell disease, thalassemia, and Tay-Sachs disease, noting that over 100 others can be tested. These disorders are typically recessive, meaning a baby must inherit a defective gene from each parent to have the disease. Carriers themselves usually don't show symptoms.
Oh, but you wouldn't know otherwise.
Often not. But if both partners are found to be carriers, the child has a 1 in 4 chance of inheriting the disease. The importance of preconception screening is emphasized. Ideally, this should occur before trying to conceive.
Why before?
This allows for a wider range of reproductive options if both partners are found to be carriers, such as artificial insemination with donor sperm, in vitro fertilization or IVF with pre-implantation genetic diagnosis, PGD adoption, or even deciding not to have children. It gives you time and choices.
That offers a lot of options, which is crucial. So how is this screening actually done, and what about the cost? Is it accessible?
It's typically done with a simple blood or saliva sample. Traditionally, screening was risk-based, meaning it was offered if you had a family history or belonged to a certain ethnic group.
Yep.
However, our sources highlight a shift toward expanded carrier screening, which tests for over 100 mutations regardless of risk factors. You can specifically ask for this expanded screening if your caregiver doesn't offer it initially.
Good to know you can ask.
Definitely. If one partner is found to be a carrier, the other partner is then screened, though both can be screened simultaneously for faster results. The good news is that the cost of carrier screening has declined dramatically thanks to technological advances.
Mumps.
And it's often covered by insurance as a recommended part of preconception and prenatal care. Even without insurance, out-of-pocket costs are typically a few $100s. A crucial point to understand is that common prenatal diagnostic tests like CVS or chorionic villus sampling and amniocentesis will not automatically detect these genetic disorders unless carrier screening has first identified the specific mutation to be tested for.
So they're different things.
Very different things. You can't rely on those later tests for this specific insight unless you've done the carrier screening first. The benefits of this early knowledge are significant. In some cases, early treatment for the baby can begin immediately after delivery, and it allows parents to line up necessary medical specialists well in advance, which can make a world of difference. Our sources detail specific common disorders. Cystic fibrosis, or CF, is a life-threatening genetic disease affecting breathing and digestion. 1 in 29 Caucasians carries the gene, and ACOG recommends all women be offered CF screening.
Okay.
If both parents are carriers, there's a 1 in 4 chance of the baby having CF. Sickle cell disease is a debilitating red blood cell disorder with high-risk groups including people of African, Caribbean, South or Central American, Mediterranean, Indian, or Arabian descent, for example. 1 in 13 African Americans carry the gene.
High prevalence there.
Yes. Thalassemia is a group of inherited blood disorders, ranging from mild to severe anemia, prevalent in people of Southeast Asian, Chinese, Indian, African, Middle Eastern, Italian, Greek, and Mediterranean ancestry. Finally, Tay-Sachs disease, a fatal central nervous system disease, has a higher carrier rate among Ashkenazi Jews, French Canadians, and Cajuns,
Specific roots.
where it's about 1 in 27 compared to 1 in 250 in the general U.S. population. Ashkenazi Jews are also at risk for other severe nervous system disorders like familial dysautonomia and Canavan disease. The importance of consulting a genetic counselor both before the screening and after receiving results to fully understand the implications and reproductive choices cannot be overstated.
Get expert advice.
Absolutely. The average risk of having a child with one of these diseases is actually higher than for Down syndrome or a neural tube defect. So the question becomes, why would you not want this information if it allows you to prepare?
That's incredibly powerful. Realizing that knowing this information beforehand can genuinely alter the course of your pregnancy and even your child's life. It truly underlines the preventative medicine aspect we talked about. And it leads us to another critical area, managing existing health conditions. It's clear that this isn't something to put off until you're pregnant. The sources really stress the preconception phase for conditions like hypertension. What's the biggest why behind this proactive approach?
When we connect this to the bigger picture, many medications for chronic conditions can be harmful during pregnancy, or the conditions themselves can pose significant risks to both the mother and the baby.
Double risk, potentially.
Right. By optimizing health before conception, you're not just preventing problems, you're also setting the stage for a smoother, safer pregnancy by potentially avoiding medication changes or complex health issues later on. It's about minimizing the medical tightrope walk, you know. Let's delve into hypertension, or high blood pressure as a prime example. Our sources reassure us that most women with chronic essential hypertension, meaning high blood pressure not caused by another condition, can have normal pregnancies and healthy babies.
That's good to hear.
However, there are increased risks for pregnant women with chronic hypertension, including a higher likelihood of cesarean delivery, gestational diabetes, and significantly preeclampsia, also known as toxemia, with studies showing a 13 to 40% risk.
That's quite a range.
It is. And this risk is further increased if you also have diabetes, obesity, kidney disease, or a history of preeclampsia. Crucially, some common hypertension medications, such as ACE inhibitors and statins, are not safe during pregnancy.
You need to switch meds.
Potentially, yes. Experts generally recommend discontinuing any antihypertensive medication during pregnancy, unless the hypertension is severe, for example, a consistent reading of 160 over 105 or higher. Your doctor will explain what these specific numbers mean for your health and why it's crucial to manage it before conception.
So talk to the doctor early.
Very early. The preconception management involves consulting with both a primary care physician and an OB/GYN to discuss how hypertension might affect pregnancy and to adjust treatment plans. Lifestyle interventions before getting pregnant are strongly recommended.
Like diet and exercise again.
Exactly. Weight loss if you're overweight, quitting smoking, regular exercise, a healthy diet with appropriate salt limitation, and stress reduction, all of which can help lower blood pressure. Once pregnant, blood pressure will be monitored frequently and potentially at home, especially in the second half of pregnancy when preeclampsia risk rises. Additionally, the baby's growth will be closely monitored via ultrasound, as high blood pressure can decrease nutrient flow through the placenta. Daily fetal movement tracking in the third trimester may also be recommended.
That makes perfect sense. Getting ahead of it is clearly the best strategy. What about other common conditions like diabetes or thyroid issues? Do they require similar proactive management?
Absolutely. For diabetes, the sources emphasize that uncontrolled blood sugar can have severe consequences for a developing baby.
Really critical.
Yes. Therefore, if you have diabetes, it is strongly recommended to see a diabetes specialist and ensure your blood sugar is well controlled before trying to conceive. This is paramount. Regarding thyroid disease, medication for hypothyroidism must be precisely prescribed and managed, as too much or too little can affect ovulation.
Balance is key.
Exactly. They also mention considering screening for antibodies to cytomegalovirus, or CMV. While CMV is a mild virus for most adults, it can be dangerous to an unborn baby. The screening is especially important if you have a child in daycare, as CMV can easily spread there and be passed to you. It's truly remarkable how much managing chronic conditions beforehand can simplify your pregnancy journey. It's like smoothing out the road ahead, creating a stable, predictable environment for your baby to thrive without added stress on your body. It's a testament to the dedication of parents-to-be, paving the way for a much smoother, healthier experience.
So it really highlights that everybody's journey to conception is different, and personalized medical advice is paramount. It makes you wonder, doesn't it? How can listeners ensure they're getting the most tailored advice given their individual history, especially concerning prior pregnancies and medical procedures? What are the key considerations there?
This is precisely where that individualized consultation with your healthcare provider becomes absolutely critical. For example, after a C-section, our sources recommend waiting 18 to 23 months before trying to conceive again.
Almost 2 years.
Yes, this is generally the same recommendation for women who deliver vaginally, but specific factors like age, fertility, and prior complications can alter this. The body needs time to recover from major surgery and replenish lost nutrients. Women who deliver via C-section lose twice as much blood, about 2 pints on average, as those who deliver vaginally, leading to potential anemia. There are significant risks associated with a short interpregnancy interval, specifically less than 6 months. These include a higher risk of uterine rupture.
Which sounds scary.
It is a dangerous complication where a tear occurs in the uterine wall, most often at the site of a previous C-section incision. Studies show the risk decreases significantly with longer intervals. 5% risk if less than 18 months between deliveries, decreasing to under 2% for 18-23 months, and just over 1% for 24 months or longer.
So time really matters.
It really does. Another very high-risk complication is placenta accreta, where the placenta abnormally embeds in the uterine wall, potentially leading to severe hemorrhaging and even death for mother and baby. A shorter interval also increases the risk of preterm birth, delivering the baby before 37 weeks, which can lead to long-term complications for the baby. Even if the baby is delivered at term, there's a slight increase in low birth weight if pregnancy occurs less than 18 months after the previous one, likely due to excessive stress on maternal nutrient levels. It's truly about giving your body the time it needs to recover and rebuild.
What if someone is older, or if they accidentally get pregnant sooner than recommended? Are there exceptions or reassurances?
For women in their late 30s, fertility concerns might lead to discussing trying to conceive sooner, perhaps 9-12 months post-C-section, with their provider, especially if the last birth had no complications.
A personal calculation.
Exactly. If you accidentally get pregnant sooner than recommended, our sources reassure you that risks vary, but immediate consultation with your provider is key to determine necessary precautions, like extra ultrasounds to check uterine and placental health.
Okay, don't panic. Call the doctor.
Oh, right. Also, for many women, VBAC, or vaginal birth after cesarean, is generally safe to attempt, though eligibility depends on prior birth details, and an online calculator might be used by doctors. It's important to note that specific hospitals or providers may have protocols or limitations regarding VBACs.
Beyond C-sections, what about other procedures, like a D&C? And how does simply stopping birth control factor into all this?
A D&C, or dilation and curettage, is a minor outpatient surgical procedure often performed for various reasons, such as after a miscarriage or to address abnormal uterine bleeding. While it's generally safe, your doctor will discuss its implications for your recovery and future fertility, which is why it's an important part of your health history.
Part of that puzzle again.
Yes. During the procedure, the cervix is gently opened and tissue is carefully removed from inside the uterus. Afterward, you can typically expect mild cramping and light spotting for a few days, and your period usually returns in 4-6 weeks, though timing can vary. While rare, potential complications like infection or adhesions can occur, but these are generally manageable. As for stopping birth control, fertility typically returns very quickly, often within a month, after discontinuing most methods like the pill, patch, ring, IUD, or implant.
Pretty fast for most.
For most, yes. However, the Depo-Provera shot, as we mentioned, can significantly delay the return of ovulation for 9 months to over a year.
It's a long delay.
It can be. You might experience the return of pre-existing PMS symptoms like acne or emotional discomfort, and potentially irregular or heavier periods. Most women will start ovulating and have regular periods within 3 months of stopping hormonal birth control, but if your periods haven't returned after 3 months, you should see a healthcare provider. It's important to remember that pregnancy is possible even before your periods become regular again.
And what about permanent sterilization procedures like tube ligation or vasectomy? What should people know if they've changed their minds?
For those who have undergone tubal ligation or vasectomy, our sources state that while these procedures are highly effective, they are not 100% successful, and natural pregnancy is extremely rare.
So, very unlikely, but not impossible.
Right. For individuals who have changed their mind, it implicitly suggests specialized consultation for options like reversal surgery or assisted reproductive technologies, or RT, as these are the paths to explore.
Requires medical help.
Definitely. The awareness of these specific medical histories and procedures truly empowers individuals to have highly informed conversations with their healthcare providers. It's about understanding the unique story of your body and how it influences the path forward, making the journey feel more controlled and less daunting.
So it's clear that preparing for pregnancy isn't just about the physical checkups and dietary changes. Our sources emphasize the mental and emotional side, too. How crucial is that piece of the puzzle, and how does it connect to everything else we've discussed about preparing for a baby?
When we connect this to the bigger picture, stress and emotional well-being profoundly impact our physiological systems, including reproduction.
Mind-body connection.
Absolutely. Addressing these aspects ensures a more resilient foundation, not just for conception, but for the demanding journey of pregnancy and parenthood. In a world full of daily stressors, the big question that emerges is, what practical steps can listeners take right now to begin cultivating this resilience? Our sources highlight that mental health is not secondary, it's a vital component of overall health and plays a significant role in fertility and pregnancy readiness. While the exact link between stress and fertility is complex, high stress levels can undeniably affect hormone function and menstrual cycles.
Stress messes things up.
It can. We are encouraged to advocate for proactive stress reduction techniques. Things like yoga, meditation, massage, deep breathing exercises, regular long walks, spending time with good friends, quiet reflection, and consistent exercise. Getting enough sleep is also emphasized as crucial for coping with daily stressors.
Basic self-care, really.
It is, but it's often overlooked. If stress feels overwhelming, seeking a therapist referral is a highly recommended step. Addressing depression is also paramount. Women suffering from depression are more likely to experience fertility problems.
Another link.
Yes. Our sources advise a mental health check before getting pregnant, especially for those with a personal or family history of depression. Signs to look for include a persistent loss of interest or pleasure in enjoyable activities, changes in appetite or sleep patterns, persistent loss of energy, or feelings of hopelessness or worthlessness.
Important signs to recognize.
Very. Strongly recommending consultation with a mental health professional for evaluation and potential medication adjustments, if currently on medication, before conception is a key takeaway. And then there's the sensitive but critical issue of domestic violence. Physical harm or emotional abuse by a partner is unlikely to improve during pregnancy and often escalates.
A very serious concern.
Extremely. The sources stress the paramount importance of being honest with healthcare providers. They detail available resources such as counseling, legal and social services, domestic violence hotlines like the National Domestic Violence Hotline at 800-799-7233, and safe havens. It's not just about your physical body, but your entire environment and emotional state. Think of it as building a strong foundation, not just for the physical aspects of pregnancy, but for the complex emotional structure of parenthood.
That's a powerful reminder that it's a full-person journey, encompassing all aspects of our lives. And it's not just about one person either, is it? Parenthood is undeniably a shared journey. Our sources also talk about involving your partner and getting practicalities like finances in order. Yeah. How does that fit into this ultimate health roadmap?
Indeed, it's absolutely a team effort. Parenthood is a shared journey, and comprehensive preparation involves your partner's health and lifestyle, as well as crucial practical planning for the future.
Takes two, right?
Usually, yes. Our sources emphasize the partner's role in providing crucial support and encouragement throughout the pregnancy journey, especially if significant lifestyle changes are being made. For male fertility, a partner's diet and lifestyle directly impact sperm count and quality.
So it's not just about the woman's health.
Not at all. Specific factors highlighted include alcohol consumption, smoking, steroid use, drug use, and exposure to very hot environments like hot tubs, steam rooms, or saunas, all of which can negatively affect sperm. Attending preconception appointments and prenatal appointments together is recommended to ensure both partners are well informed, and attending childbirth classes as a team is also strongly encouraged. It builds a shared understanding and sense of responsibility. Financial planning is another critical aspect stressed by our sources, aimed at reducing stress during pregnancy and beyond.
Practical side.
Yes. It involves contacting your health insurance company now to understand prenatal coverage, in-network versus out-of-network provider costs, deductibles, and planning to save for high ones, and which tests and procedures are covered, noting that many preconception and prenatal services are fully covered under the Affordable Care Act.
Check your insurance.
Definitely. For those without insurance, resources like healthcare.gov or local health department programs are mentioned. They also suggest using tools like a cost of raising a child calculator to get a realistic understanding of potential long-term expenses. It helps demystify the financial side of parenthood.
And beyond the practicalities, what about the emotional readiness as a couple? How do you really prepare for the monumental shift of bringing a child into your lives?
That's where open and honest communication truly comes in. Our sources encourage a thorough, deep conversation with your partner about what bringing a child into the household means.
The big talk.
Exactly. Key discussion points include anticipated lifestyle changes, the division of household labor and childcare responsibilities, balancing work and family life, preparedness for parenting a special needs child, mutual commitment to becoming parents.
Heavy topics.
Important ones. How religious, ideological, or cultural differences might affect parenting choices, identification of a support network of family or close friends, financial stability, and housing security. They also suggest being prepared for the physical and mental impact of pregnancy and childbirth on the primary parent.
Being realistic.
Very. For real-world insights, talking to other parents about their experiences, both challenges and joys, and even visiting friends or family with small children is advised to get a realistic feel for daily life with a baby or toddler. This open communication and shared understanding across these practical and emotional domains not only mitigates future stress, but also strengthens the partnership, transforming it into a cohesive unit ready for the demands of parenthood, laying the groundwork for a more harmonious family life.
Finally, we've talked a lot about preparation, but when it comes to the act of conceiving itself, timing is often everything. What do our sources say about understanding and pinpointing ovulation to make the process more efficient?
It's truly fascinating how much information our bodies give us if we just learn to listen.
Tuning in.
Exactly. While tools and tracking are incredibly helpful, there's a broader psychological benefit of tuning into your body in this way during the preconception phase. For many, understanding and pinpointing ovulation is a practical step to increase the chances of conception, making the process more efficient.
How do you do that?
Our sources detail several methods for tracking ovulation. An ovulation calculator can provide a rough estimate useful for initial guidance. Basal body temperature, or BBT, charting involves tracking a slight rise in body temperature that indicates ovulation. Consistent tracking over several months helps identify your unique patterns.
Takes some dedication.
It does. Observing cervical mucus changes can also signal fertility, and again, consistent tracking helps in recognizing your body's own signals. Finally, ovulation predictor kits, or OPKs, are over-the-counter kits that work by detecting hormone surges in urine or changes in chloride in saliva or on the skin that precede ovulation.
P-sticks.
Essentially, yes. They typically cost between $15 and $50 per cycle and are widely available. When it comes to fertility return post-birth control, for many women, fertility returns very quickly, often within a month, after discontinuing most methods like the pill, patch, ring, IUD, or implant.
Good news for many.
Yes. However, it's important to reiterate that the Depo-Provera shot can significantly delay the return of ovulation for 9 months to over a year. While some healthcare providers might suggest waiting for a couple of normal periods after stopping birth control to establish a more accurate due date, it is completely safe to start trying right away. If pregnancy occurs before cycles become regular, an early ultrasound can accurately date the pregnancy.
So you don't have to wait.
No. The psychological benefit of tuning into your body through these methods is that it can make you feel more in control and empowered on your conception journey.
This deep dive has truly unpacked the incredible journey of preparing for pregnancy. We've covered everything from essential preconception checkups and vital genetic screening to optimizing your diet, breaking unhealthy habits, and the profound importance of mental well-being and involving your partner.
When we connect this to the bigger picture, it's clear that preparing for a baby extends far beyond just trying. It's about a holistic readiness, a commitment to both your health and the future health of your family.
It really is.
It's an investment in a thriving start, a true act of love.
So what does this all mean for you, the listener? As you consider this incredible journey, perhaps the most empowering takeaway is that while there's much to learn and prepare for, every proactive step you take towards optimal health before conception is not just for yourself, but a profound investment in the well-being of your future family.
This begs an important question. What's one area from today's deep dive you're now inspired to explore further or implement first on your personal roadmap? Remember, these sources are here to empower you, not overwhelm you. Use them as a starting point for informed conversations with your own healthcare provider. Your personal health journey is unique, and getting expert guidance tailored to you is always the best next step.